For many years, the World Health Organization in Kenya has strived to play a key role in ensuring that the overall health goals of the Kenyan population are attained.
We work predominantly upstream, working mainly with policy makers, decision makers at headquarters, at provincial level, doing upstream functions, mainly supporting policy development in different aspects of health interventions, in health systems, human resource development, supplies of commodities and other essential drugs that are needed to run functions in various parts of the country. We also work in the area of improving the capacity for human resource in this country for healthcare delivery. We do this through skills development training. We run lots of workshops in Kenya, we give out training guidelines and so on.
By supporting the government directly or through a wide range of collaborative programs with partner organizations, WHO aims at increasing access to basic health care.
Community focus that government has put in place recently is really helping. Kenya is beginning to register some positive developments on matters of health.
Massive efforts have been put in place to control tuberculosis, and yet the treatment success rate has not reached the expected global targets.
The healthcare system that is in place right now needs to absorb more healthcare workers so that we can be able to move forward the agenda of fighting TB.
In order to change this trend, WHO is supporting the Ministry of Health to implement new interventions so as to help the country achieve the expected global targets.
For many years, TB program has stood on its own and it has its own core functions, and HIV program has done the same. And we have been focusing on the patients, but in a different perspective, in the sense that the HIV program has been focusing on HIV patients and HIV per se, and the TB has been focusing on TB patients and TB per se. But we have realized over the years now that the two diseases are actually going together. So what we have done in the recent past is to bring the two programs together so that we focus on a patient. We don't focus on the disease.